Overwhelmingly, the people we support have been exposed to what we call betrayal trauma. And that's when their trust has been betrayed by someone who was supposed to keep them physically, emotionally, and psychologically safe. 70% of people with intellectual disabilities report being the victim of violent, sexual, physical, or financial abuse. They are 90% more likely to experience multiple occurrences, and only 37% report to the police. People with intellectual and developmental disabilities are 7 times more likely to be sexually abused than the general population. Mental health resources are scarce, and the people that we support really are in need of counseling and services, but most practitioners haven't even been trained on people with intellectual and developmental disabilities.
The Arc Northern Chesapeake region is seeking to better meet the growing need for mental health resources in the community we support. All of us are aware of how the COVID-19 pandemic has illuminated the importance of mental health in our community. We are in the midst of a mental health crisis. During the course of the pandemic, CDC data shows that 72% of communities in the United States did not have enough mental health providers to serve residents. And tragically, CDC data shows the second leading cause of death for ages 20 to 34 is suicide. Resources are overwhelmed, and of those resources, precious few are trained to support those with intellectual and developmental disabilities. Our Fund the Need campaign for 2022 will focus on raising money to address mental health needs for people we support through the work of our clinical supports team, which is largely underfunded. Though the team is small in number, they are mighty in providing support to all of our agency's programs, and we are looking forward to their growth to better empower those we support to live, work, and thrive.
Clinical helps each department in different ways, whether it's community living, community partners, supported employment.
Erica and Kim being licensed social workers, and myself as a behavior analyst, and Hillary with her behavior technician training. We support 100% of the people, as well as their staff.
I feel fortunate. More people who need this clinical, the behavioral type of support are staying working, and they're more successful at work. Whereas without this support, it could cause them to lose their job.
If we don't treat people's trauma, their behaviors aren't going to change. A lot of what we do is around training staff and supporting individuals who are struggling.
It's really just giving them the training and the knowledge about the individual so they can best support them. And we talk about, if somebody does this, then they should respond in this way.
It's been a great learning experience for myself and my team, and we're just soaking it all in.
At the end of the day, we just want everybody to be able to live their best life.
It's important to learn and get educated about it, because if you don't know what you're going through, then you won't know what to do. What's important to me is my friends, my family, the Arc, because I've lived here for 10 years. It's important to be positive, because if you're not positive, then you're just going to be down in the dumps all the time and be negative around other people, and you don't want to put people down. You want to lift people up, and like the Arc has done for me.
One of my goals when I came to the Arc was a therapy dog. Hero Dogs trains service animals for veterans, but not all dogs can be service animals for a variety of reasons. And so the dogs that aren't able to be service dogs are used as facility or therapy dogs. And so the Hero Dogs donated to the Arc Honor.
Honor is a very important member of the clinical team. So many people don't feel like that anybody understands, and talking to an animal who just kind of sits there and listens, and somebody you can pet, and tell about your feelings and just think about like, oh, there's this dog, and sometimes people will just sit and talk to Honor.
Honor was in my office, and I would be working, and people would come in and just pour, their heart out to her.
Honor makes a huge impact.
Now that you have met Honor and our powerhouse team of staff who are supporting hundreds of people receiving our services, as well as hundreds of staff who are learning to provide the best services possible, all while being a heavily underfunded program, we hope that you will join us in raising money to support their work in addressing mental health needs for people we support. Our total fundraising goal is $30,000. Your support is of tremendous value to our mission, especially during this time of need for mental health resources in our community. Thank you for your support.